Hello everyone. Once again, welcome to our MRCOG 3 ADC. Now we are moving on to the urogynecology module. So here, this is also all the modules are important. This is a lengthy module. This like maternal medicine, it is a lengthy module, and fertility, subfertility. Urogynecology is a lengthy module. A lot of things are we need to ask, but you need to know same thing, targeted history. That is why you need to know what to ask and what not to ask. So here again, all the domains are covered, all the 5 domains you need to cover, and then detailed history, as in any other module, detailed history, investigation, and here they will have the fluid diary. Usual sometimes it will be enclosed. Urodynamics study also, sometimes the trace will be there, and you have to read it. So especially for the teaching station, it is more important. But for the simulated patient task, the urodynamics, I mean, you need not explain so much to her. But in teaching station, you need not need to know everything. Now we need to. Sometimes we have to refer, and we need to do the follow. And sometimes we have to refer to the tertiary care level care with MDT team, multidisciplinary team, and also you need to communicate with the colleagues like urogynecologist. So you need to do that. Then it can affect some problems affect their psychological status also. It has got a lot of some conditions affect her. Like urge incontinence, urinary stress in urinary incontinence, which causes her embarrassment and psychological, it will affect her psychology also. And lifestyle modification plays an important role here. So most of the cases you need to take this word, lifestyle modifications. Urine analysis is for every case, almost every case, urine analysis. Urodynamics, not every case, there are some indications. It's like you need to know where you have to advise urodynamics, like not stress, pure stress urinary incontinence, don't say urodynamics. So what are the indications you need to know? One is voiding difficulties before starting the treatment. Always before starting treatment you need to do the urodynamics. And so then because when you start anticholinergics, they can cause sometimes urinary retention. So for avoiding difficulties, you have to do urodynamics before starting the treatment. And also whenever pure stress incontinence, urinary incontinence, you are not supposed to. But if she had a surgery and it failed, then you and anterior compartment prolapse also, or anterior compartment prolapse, you have to go for. You can advise the urodynamics, detrusor overactivity, and voiding dysfunction. And sometimes, so then in the treatment fails. And when the diagnosis, you're not certain about the diagnosis. These are the conditions, few conditions where you go for urodynamics, and you need to know what is the anatomy, physiology, and pathology of the anatomy, pathology of this pelvic floor and urinary tract. Now, with this brief introduction, you can expect in this stress urinary incontinence, urge urinary incontinence, mixed urinary incontinence, waste, both will be there. You need to know what is predominant. So then the other thing is what these are the things which you can get, and so sensory origins also you can get, and urethral diverticulum. So anything can be asked, and urodynamics is a structure discussion. Urodynamics you need to know. Now, so moving on to the station. This is a simulated patient task. Your Stage 5 in urogynecology clinic, you're about to see Mrs. Mercy Matthew, 48-year-old, who has been referred by her GP. And reference letter will be there. So his letter shows that she's Mercy Matthew, 48 years, and so you confirm this name, which is given in the station. Dear doctor, I would like to see you to see Mrs. Mercy Matthew, 48-year-old, who is experiencing the following symptoms since 3 to 4 years. She's having urgency, frequency, and recently she's wetting herself. She's impressed about it and very much worried. Naturally, this is what usually they come with. And BMI 35. Most of them will have high BMI, and this is affecting her daily activities. I have advised her to keep a bladder diary, which is enclosed. Her urine dipstick is negative. I have arranged for urodynamic studies for her. Kindly do the needful. So this is what the GP letter says, and you have to take the targeted history, answer her concerns, explain the management plan. So this is where we are going to start with this. This is the scenario. Now with this, you have an idea. Urgency, frequency, that means it goes in, and leak. Sometimes she is wetting, that means leak. So you have urgency is urge incontinence. So it goes more in favor of overactive bladder, not stress. Because if it is stress, they'll say she's leaking on exertion or exercise or sneezing whenever there is increase in the abdominal pressure. But here that word is not there. So it goes in favor of, sometimes they give mixed also. So along with this, there is a leak when she coughs. That if that word is there, then you think about mixed urinary incontinence. Here, he did not say, they did not mention that. So he just said wetting herself. So, so then mostly it is more of a urge urinary incontinence or overactive bladder. Now I'm starting the station. Hello, I'm Dr. Manjula, one of the doctors in the Urogynecology clinic. May I confirm your name and age, please? I'm Mrs. Mercy Matthew, doctor. I'm 48 years. How may I address you? No, I'm so Mercy, Dr. Mercy. You can call me Mercy. So this is the introduction. Now coming to the agenda. Mercy, I can see from your GP letter that you have some concerns with the waterworks, and so you're here to discuss about it. Isn't it? Yes. So Mercy, I shall address all your concerns. But before that, can I get some details, few details about you, which helps me in our management plan? Yes, doctor. Now, open. Now you're coming to the information gathering. So, complaints. First, the complaints. So, can you tell me more about you? Always open question. And so doctor, she will say, doctor, I'm frequently passing urine. Daytime it is like 10 to 12 times I need to go to the toilet, and nighttime also. No, sometimes she'll say nighttime also. Then otherwise you say, what about night? So she'll say, nighttime also I'm going for 3 to 4 times, doctor, and really it is disturbing my sleep. So do you then you say, do you need to anytime do you need to rush to the toilet? Rush urgency. So yes, doctor, I feel that I need to rush also. That is, she came with urgency. Then, do you leak before you reach the toilet? And then, yes, doctor, before I reach, then some urine is coming out. So, any cough? Do you have any leak on coughing or sneezing? No, doctor, I don't have that. So you're ruling out stress urinary incontinence. Now, suppose she says yes, that yes, doctor. Sometimes I feel when I'm doing some sneezing or coughing, some urine is coming out. That means this is going more in favor of mixed urinary incontinence, and see which symptom is dominating. So now, so then you say, do you see any dribble when after passing urine, after the completely passing urine? Do you feel some dribble? That means you want to rule out urethral diverticulum. Then, any burning pain? Do you have any burning pain while passing? No. That means you're ruling out urinary infection. Is there any difficulty in avoiding dysfunction? Any any thing that is did you notice that anything is increasing this problem? Your problem is anything increasing? That means aggravating factors. Yes, doctor. Whenever I take coffee, I noticed whenever I take coffee, tea, or alcohol or beverages, I feel the problem is increasing. Okay. And also, I noticed, doctor, whenever my bladder gets filled up, if I don't rush to the washroom, the toilet, I feel a lot of pain. And so, okay. Now then, what makes you less? What factors will relieve it? So, did you notice any? Did you notice? Yes, doctor. So what I felt is when I started reducing this alcohol and the coffee and caffeine and all, I feel that pain is less. And also, whenever I empty the bladder, I feel the pain is becoming less. Okay. So then, can I ask a few personal questions, Mercy? They may be intrusive. Yes, doctor. Are you sexually active? Always confirm whether she's sexually active or not. Before, don't ask without asking. She may not be sexually active also sometimes. So then you say, are you sexually active? Any pain when you have sex? Any pain? Do you feel any pain? Any then? Yeah, yes, doctor. I have really pain. Is it affecting your sexual life? Yes, doctor. And it's affecting my quality of life also. I'm not able to work also properly. It's really embarrassing. I'm very sorry. I'm very sorry. We are here to help and show some empathy. And we are helping to here to help and support you. Have you taken any treatment before coming to us? Yes, doctor. I means treatment means when I consulted our GP, he told me to cut short this because I used to smoke. Then told me to cut short smoking and also avoid excessive of limit coffee, tea, and coffee, caffeine, and beverages. So I did that, and I feel I'm little better, doctor. So then, okay, moving on. Coming, can you tell me more about your periods? Do you get periods regularly? Yes, doctor, I get my periods. When was your last period? Date of the last period? You need to ask because she's 48. She, always you have to ask before menopause. So she can always conceive. So date you take, and then how about your cervical screening? Are you regular? And how about it? They're normal. And are you using any contraceptives? So this is the gynec history. And can you tell me were you pregnant before? Take a brief obstetric history. And if so, if she says pregnancies, what type of deliveries? They were normal deliveries or cesarean? And how was the baby at the time of delivery? Then how was your recovery? These are the things you should ask. For stress urinary incontinence, you need to ask about obstetric is important, and also for mixed urinary incontinence because the pelvic floor becomes lax and they can have for stress urinary incontinence or mixed with stress. That which so difficult deliveries, that time you should ask difficult deliveries, big babies, so the prolonged labors. So these are the things which will birth during these are the things which you should ask. Um, so to know that if she has stress urinary incontinence symptoms. So this is about the obstetric history. Moving on to the medical history, you ask about, because this is your thinking in your mind now, that after reading the station, you think that it is a overactive bladder. So what are the reasons, what are the causes of overactive bladder? You just quickly think about, and in those direction, you ask the medical history. So there can be some nerve conditions. So diabetes, hypertension, and sometimes asthma, because it is causing cough. That is why cough can cause, if it is stress urinary incontinence. And now you ask her, do you have any problem with the nerves? Any medication? Are you taking any medication for any nerve problem? Or any sugar? Are you taking any medication for the increase in the sugars? Do you take medication for, do you have increase in the blood pressure? And any cough? Do you have long-term cough or asthma? Then you have any eye problem? Do you have any eye problem? Because we want to give medication for this, we need to rule out glaucoma. Then, how about operations? Have you undergone any surgeries on your tummy or down below anytime? And then, second, then any family history of any significance? Okay. And then, can you tell me whether you smoke? Then because she smokes, suppose she says she smokes, then you ask the numbers, and then you say, well, because smoking, let me if you permit, let me tell you, Mercy, smoking is not good for health, and it can cause increase this problem. What problem you're facing, it can increase your problem. So if you permit, we will refer you to the NHS smoking cessation program, where they will advise you how to quit smoking. They'll help you to quit the smoking. Same thing with the alcohol also. There you have to send to the de-addiction center, take her permission and send her there. Then how about so this is the smoking, alcohol, drugs. Pardon me for asking, do you take any recreational drugs or drugs for fun? And what do you do for living? You want to know what type of work, because if it involves strenuous exercise, strenuous work, weightlifting of heavy weights, so that is more, it is more important in stress urinary incontinence and prolapse. So occupation is important. So she will say, yes, doctor, I'm working in some supermarket where I have to lift a lot of weights. So commonly they will say this. And then occupation is over. Now you ask about, how about the fluid intake? What type of, how much of fluid do you take, Mercy? Then she says about the maybe 1 liter, doctor. So that means lesser than normal. Normally they should take 1.5 to 2 average per day. And then you take how much of quantity she's taking. And then quantity, then after, what type of fluids you take, then she will say alcohol, coffee, tea, beverages, fizzy drinks, whatever she takes, she will tell you. So then about the type of fluids and all, you note down what you remember, that's all. Then how is the support at home? Because she will be very much upset psychologically, she will be very upset with the problem. She needs a lot of support from the family. So how is the support? And is it this problem making you, affecting your mental health? Do you feel down or depressed? Do you need some, shall we arrange some counseling for you? So these are the things you should cover in your information gathering. With this, the information gathering is over. It takes time, but you have to take relevant, you need to cover all the conditions which fit into this station, which fit into. So not mass and all prolapse. It's not prolapse. So don't ask about mass, prolapse, this and that. So what is necessary, you fits into this, you ask. Then would you like to add anything? Yes. No, doctor. Then, okay. Examination, what happens? See, Mercy, can I examine you in the presence of chaperone? because you have to explain why you want to examine. My nurse will check your blood pressure and pulse rate because she is a middle-aged. Better to check her temperature, this thing, blood pressure, and also I will check your tummy and also down below to check whether you have any leak. So when you do the speculum examination, local examination, you will ask her to cough and see whether normally we do in the clinics. See whether there is any leak. I would like to see whether there is any leak or any discharge because of any vaginal discharge, any infection, any excoriation of the skin. Because whenever she leaks, some amount of always that wetting will be there. So that can cause skin excoriation. So can I examine all this? So then she will say, yes, miss, thank you for allowing me. So now, Mercy, I will explain to you. I'll explain to you about your condition, and I'll take you to the management. Hmm? So I have seen your report, that is urine report, which your doctor has advised. I checked, confirmed name, age, and NHS number. It shows that there is no infection in the urine. The second thing is, I have seen your bladder. There's a bladder diary which you have maintained, that is bladder diary, and I have seen that you are having your need to pass to urine more number of times during day and sometime night also, which you have mentioned. That is bladder diary also shows the same, and also some fluids are affecting you. So, and the third thing is, there is that bladder pressure studies also. The report I have seen, it shows that the bladder is overactive. It is whenever it is getting filled up with a small quantity, then it is squeezing. So this is the problem you're facing from your history. See, Mercy, from your history, from your examination and the investigations what you have done, you have a condition called overactive bladder, or it is otherwise called urge urinary incontinence. So, shall I, okay, am I clear so far? Yes, doctor. What is this condition, doctor? Can you tell me more about it? Yes, I'm going to tell you about it. It is the increase, that is, there is an increased sensation. Whenever, even with small volumes of urine in the bladder, there is increased sensation when you have regular and sudden compelling desire to pass urine. That is called urgency. Even with small quantities of urine in the bladder, you feel that compelling desire to pass urine, and that sensation is difficult to put off. You need to rush to the toilet because the bladder starts squeezing, and before you reach, sometimes the urine leaks out. So this is what is happening. So then sometimes, then why, doctor? Why it happened to? Why it happens? It could be. See, there are reasons, Mercy. There could be many reasons. One could be because of the infection. There could be some infection in the bladder, or there could be some increase in the sugars, which also causes frequent infections in the urine. They could be because of the nerve condition, some condition of the nerves of the bladder, or sometimes one disease, the bladder can be affected by some diseases, or there can be pressure on the bladder from outside. So these are the few conditions we can think about, Mercy. And we will try to do some tests and we will see what could be the reason. But anyway, I'm sorry to see you in such a difficult situation. So we have a team of doctors who are, that's called a multidisciplinary team, who will manage you. And that is our consultant, urogynecologist, our incontinent nurse, and counselor. So these are the people who will involved in your care. Shall I tell you about that management option? Yes, doctor. Tell me, what is it curable? Yes, doctor. So let me tell you. So now, first thing, what I want to tell you is lifestyle modification. So that means you have to. Before that, I will tell you. We'll find out the cause. What could be the cause? So we will send a sample of blood to rule out sugar, that is diabetes, and also we will see. Then when do a scan, we'll arrange a scan, ultrasound scan, that is to check how much of the urine is remaining in the bladder after you void. So this is second thing we need to do. Third thing is, now this is the urine, already we have checked the infection urine, there is no infection in that. Then urodynamics, that bladder pressure studies is already done for you. So now moving on to the management, lifestyle modification is very important, Mercy. That's the first line. So what you need to do is you have to modify your fluid intake. Fluid, that is, that means like what, doctor? So I will tell you, cut down fluids after 5 p.m. You cut down fluids, and your fluid intake per day should be around 1.5 to 2 liters. That is around 7 to 10 cups per day. And you need to, as you told me, you're already avoiding coffee and alcohol. Continue that. Avoid coffee, alcohol, caffeine, and beverages. Stop smoking. and which are then these, because these will cause irritation of the bladder, and that will worsen your problem. Am I clear? Yes, yes, doctor. So now, but at the same time, I want to tell you, take adequate fluids. Don't take less fluids. Take adequate fluids. Okay. Now, can I move on to the second thing? That is because you see your weight is more, your BMI is more. So I would like to, I mean, it is because that will increase the problem. I will, if you permit, I'll connect you to the diet and exercise program. So they will advise you how to reduce the weight and optimum diet. And then third thing is we will tell you how to do the bladder training. The next thing is you need to do the bladder training. That is our incontinent nurse will help you how to train your bladder. That means you need to they will help you to hold more quantities of urine, and so that whenever you get that urge, you will override that urge to pass urine. So try to hold more quantities of urine, override that urge to pass urine. This is the training. They will teach you, our incontinence will teach you. Okay. Yes, okay, doctor. Then coming to the, if suppose she has stress urinary incontinence, along with that, then you can say pelvic floor muscle training. Supervised pelvic floor muscle exercises, you can say. If she doesn't say, in this it is not there, then you need not. Now, if there is, with this lifestyle modification, if you don't have relief, then then next we will move on to the next line of management. If there is no relief, that is the medical management. Shall I explain to you? Always you take a permission. And also, in chunks you'd say, yes, doctor, tell me about that also. Then, these are called anti-muscarine drugs. These drugs are called anti-muscarine drugs in medical terms. They will work by blocking the nerve impulses from the brain, which stops bladder from squeezing and helps the bladder to become calm, so that it will hold more urine. So it will hold. So this way they will act. Some drugs like oxybutynin are there, or tolteridine. Some drugs are there. So we will rule out the allergies and then give the drug. We will go stepwise, Mercy. We will go stepwise. We'll start with one drug and then see its effect. If it doesn't work, we'll move on to the other drug. So, what type of drug you will give? How to take, doctor? Yes, you will take this oxybutynin. Suppose we start with it. We will give you for 4 weeks. Because it will take. We will see the effect for after 4 weeks, because it will take time to act. And if it starts acting, if you become better, we'll continue that. Then you need to take it around for 4 to 6 months, and we will see you annually. Am I clear, Mercy? Yes, doctor. Then sometimes it can have some side effects also. The benefit is you will have relief of problem. The side effects is it can cause some nausea, some dryness of the mouth and blurring of vision, sometimes constipation. Sometimes it can increase the pressure in the eye called glaucoma. So this is what sometimes it can happen. If you feel any type of these things, you need to report to us. Okay, Mercy? Yes, doctor. Suppose you are not able to tolerate. Suppose this is causing problem for you, or that nausea and all, we will give it as a patch. Okay. Yes, doctor. Suppose the doctor it doesn't work, then what should I do? Then we will give you another medicine. That is, if it doesn't work for you after 4 weeks, then we will give second drug, that is mirabegron. That's called. But because you don't have but it's not given when the blood pressure is high. But in your case, you don't have blood pressure, we can give you. Here also we will see it. We'll give it for 4 weeks and see the effect. And so then, if there is improvement, you need to continue. But if there is no improvement with this also, then we will send you to the specialist team of doctors. That is called multidisciplinary team. Am I clear? Yes, doctor. So now, sometimes they will ask only medical management. Then you have to, in the station, then you have to stop here. Otherwise, sometimes if they don't ask anything, then you have to explain to her briefly about the next step also. So now, if the medical treatment doesn't work, we move on to the other treatment. That is, that we will send you to the special, that is a multidiscipline team, where they will do a special test. That is. First, they will do the bladder pressure test. That is already done for you. That's called urodynamics. First, they will do that. And anyway, you have done it already. So then they will pass a telescope. It is done under they'll numb you and then do that area. And then they will pass a telescope. And then they will see into the bladder, into the water bag and water pipe. Then they will inject one injection called botulinum into the wall of the bladder. because and this injection, this will medicine will numb the bladder, it relaxes the bladder, it strengthens the lining of the bladder. Am I clear? So because of this, you will have relief of pain and you can hold more urine. And but you may have to repeat the injections. One injection may not be enough. You may have to repeat the injections to get relief from this problem. And at the says, is it safe, doctor? Yes, it is safe. Sometimes it can have some side effects, like you can have free urinary infection because we are injecting into the bladder, we are passing through the telescope. It can cause some infection, and then there can be some difficulty in passing urine. You can have some difficulty in passing urine, and also sometimes. Then if suppose it is does we'll see the effect and see if it still doesn't work, then we have to move on to the other thing mode of treatment, that is called nerve stimulation. Shall I explain to you that? Yeah, yes, doctor, tell me. So, the nerve stimulation that is done in the tertiary center, there are two types of treatment. That is, one is we will stimulate here, put a needle behind the ankle, and this stimulates the nerve at the back of the leg. So, this reduces the squeezing of the bladder. This way it acts. It is called percutaneous tibial nerve stimulation. And one more method, another method also is there, the nerve stimulation, where we insert the needle into the back and then backbone, and to suppress the nerve that controls the bladder. So these both the things will cause the reduces the squeezing of the bladder. This is the second method is sacral neuromodulator. But it is effective. The benefit is you will get the relief, but there can be some disadvantages also, Mercy. Like they can be, you'll have retention of urine, that is you won't be able to pass urine, and also sometimes you need catheterization. That's we have to pass a catheter to remove the urine. Then the last option will be surgery. If nothing works out for you, the last option is surgery, which we will discuss later when the need arises. Is that fine? Yeah, and am I clear so far? So now, do you have any concern, any other doubts? No, doctor. So now, I will document whatever we have discussed. This is the information leaflet, written information leaflet. This is about what we have discussed about your condition, and you can go through, and you will connect you to the support group who are facing similar problem. And because you're facing this problem, it may affect you also. If you need, I'll connect you to the counselor also, and I'll give an appointment with my consultant, and then you can come and meet him next appointment. And if you permit, I'll write back to your GP. So, anything else, Mercy? No, doctor. Thank you, Mercy, for spending your time with me. Thank you.